Well, today, Virginia lawmakers pressured the Secretary of Veterans Affairs about ongoing staffing issues here in Hampton Roads.
We're talking specifically about the newly opened Veterans Affairs outpatient clinic in Chesapeake. Lawmakers say they've seen little progress in finding qualified healthcare workers. Our Emily Harrison has more on the fiery Congress exchange.
Congressman Bobby Scott and Secretary of Veterans Affairs Doug Collins butted heads on the Oversight Committee floor. It comes after a January deadline to bring in more healthcare workers to Chesapeake's latest outpatient clinic came and went.
I expressed concern that the clinic would be opening with only 150 staff members. You called me a liar.
At the time of the clinic's opening, only 150 people work there out of the 550 workforce capacity. Secretary Collins spoke to 13 News Now weeks before the clinic opened and said the plan was always to increase staff alongside patient demand.
All of these clinics open in a phased-in fashion. It's going to offer primary care, mental health. It's going to offer pharmacy services. It's going to do exactly what it's supposed to do.
But more than a year later, the timeline for more staffing is still unclear.
When do we expect it to be fully staffed?
When we get the 166 hired.
Congresswoman Jen Kiggins also questioned Secretary Collins about the past January deadline. Secretary Collins says the clinic is now up to 355 staffers, and the hiring process continues.
There's 335 that are encumbered, 199 that are vacant. Out of those 199, 166 are in active recruitment right now. 27 are pending, 5 are pending, just getting back to us. But let me also state that that facility is now doing every service it was provided to do.
Emily Harrison, 13 News Now.
Secretary Collins says there's a massive shortage in qualified nurses and doctors willing to work in clinics across the country, and that's where the problem lies. But Congressman Scott disagreed, saying the federal government has attacked the federal workforce, and that's what's causing the delays.